Quitting smoking is a significant accomplishment that yields numerous health benefits. However, former smokers often remain sensitive to nicotine, a highly addictive stimulant found in tobacco. Even after quitting, exposure to secondhand smoke can trigger various symptoms, including headaches and eye twitching. This sensitivity arises because nicotine continues to affect the body long after active smoking ceases. Nicotine acts as a vasoconstrictor, meaning it narrows blood vessels. This constriction reduces blood flow to the brain, potentially leading to headaches, particularly in those predisposed to migraines. Moreover, nicotine can stimulate pain-sensitive nerves, further contributing to head pain. Even brief exposure to secondhand smoke can trigger these reactions in former smokers, reminding them of their past habit and its lingering effects. The challenge lies in the fact that nicotine receptors, which bind to nicotine, remain in the brain even after years of abstinence. These receptors can be reactivated by even small amounts of nicotine, leading to familiar cravings and physical responses. This persistent sensitivity underscores the importance of avoiding secondhand smoke altogether to prevent discomfort and potential health risks. Environmental factors can play a significant role in triggering headaches and eye twitching in former smokers, particularly when combined with secondhand smoke exposure. These triggers can exacerbate nicotine sensitivity and contribute to overall discomfort. Common environmental stresses include loud noises, bright lights, and crowded spaces, all of which are frequently encountered in bars and other social settings. Loud music, common in bars, can be a potent headache trigger, especially for those prone to migraines. The intense vibrations and pressure changes caused by loud noises can irritate the nervous system and lead to throbbing pain. Similarly, flashing or fluorescent lights, often found in bars and clubs, can trigger migraines and eye strain, causing discomfort and even visual disturbances. Moreover, crowded spaces often lead to poor ventilation, trapping secondhand smoke and making it more difficult to avoid. This concentrated exposure can exacerbate nicotine sensitivity and trigger symptoms. In addition to smoke, crowded environments often contain other irritants such as perfumes, cleaning products, and dust, which can irritate the eyes, nose, and throat, further contributing to discomfort. Cluster headaches are a specific type of headache characterized by their intense, debilitating pain, typically localized around one eye. Unlike tension headaches, which are often described as a dull ache, cluster headaches produce a sharp, piercing, or burning sensation that can be excruciating. These headaches derive their name from their tendency to occur in clusters, with multiple headaches happening over days, weeks, or even months, followed by periods of remission. The exact cause of cluster headaches remains unknown, but they are believed to involve the trigeminal nerve, which carries sensory information from the face to the brain, and the hypothalamus, a part of the brain that regulates sleep-wake cycles and hormone release. While not fully understood, research suggests that nicotine may play a role in triggering cluster headaches in susceptible individuals. Along with intense pain around one eye, cluster headaches often present with other symptoms, including tearing of the affected eye, redness in the eye, a stuffy or runny nose, sweating on the face, and restlessness or agitation. These accompanying symptoms further distinguish cluster headaches from other types of headaches and highlight their severity. Eye twitching, also known as myokymia, is a common condition characterized by involuntary spasms of the eyelid muscles. While usually harmless and temporary, persistent or frequent eye twitching can be bothersome and may indicate an underlying issue. Several factors can contribute to eye twitching, including stress, fatigue, caffeine consumption, and exposure to irritants like smoke. Stress and fatigue are common culprits of eye twitching. When stressed or tired, the body releases hormones like cortisol and adrenaline, which can affect muscle function, including those in the eyelids. Caffeine, a stimulant found in coffee, tea, and some sodas, can also trigger eye twitching by increasing the excitability of nerves and muscles. Exposure to irritants, such as smoke, dust, or pollen, can irritate the eyes and lead to twitching. Secondhand smoke, in particular, contains numerous chemicals that can irritate the eyes and respiratory system. For former smokers, this sensitivity may be heightened due to previous exposure and lingering inflammation. Section 5. Pre-visit. Planning for safer outings. For former smokers, navigating social situations that may involve secondhand smoke exposure requires proactive planning and consideration. By taking a few precautionary steps before heading out, you can minimize your risk of experiencing unpleasant symptoms and enjoy a more comfortable experience. First and foremost, consider the venue. When choosing a bar or restaurant, check if they have a designated smoking area or if smoking is permitted indoors. Opting for venues with outdoor seating or well-ventilated spaces can significantly reduce your exposure to secondhand smoke. Many establishments now prioritize smoke-free environments, making it easier to find suitable options. If information about the venue's smoking policy is not readily available online or through word of mouth, don't hesitate to call ahead and inquire. Explain your sensitivity to smoke and ask about their ventilation system or designated smoking areas. This simple step can save you from potential discomfort and allow you to make an informed decision about where to spend your time. Section 6. Protective measures in smoky environments. Despite your best efforts to avoid smoky environments, there may be times when exposure is unavoidable. In such situations, taking protective measures can help minimize the impact of secondhand smoke on your health and well-being. These measures involve creating a barrier between you and the smoke, as well as considering personal habits that can influence your sensitivity. Wearing a mask, particularly an N95 mask, can significantly reduce your exposure to harmful particles in secondhand smoke. While it may not completely eliminate all irritants, a mask acts as a physical barrier, filtering out a substantial portion of the smoke and providing a layer of protection for your respiratory system and eyes. In addition to wearing a mask, try to position yourself strategically within the environment. If possible, choose a seat or standing area that is further away from smokers and closer to windows or ventilation systems. These areas tend to have fresher air circulation, diluting the concentration of smoke and reducing your exposure. Section 7. Staying hydrated and taking breaks. Staying adequately hydrated is crucial for overall health, but becomes even more important when navigating environments that may trigger headaches or other discomforts. Dehydration can exacerbate headache symptoms, making them more intense and prolonged. When exposed to secondhand smoke, staying hydrated helps your body flush out toxins and reduces irritation. Carry a water bottle with you and sip on water throughout your outing. Avoid excessive consumption of alcohol or sugary drinks, as these can dehydrate you. If you choose to consume alcohol, do so in moderation and alternate alcoholic beverages with water to maintain hydration levels. Taking regular breaks from smoky environments can provide much-needed relief for your respiratory system and help clear your head. Step outside for a few minutes to breathe in fresh air and give your body a chance to recover from the exposure. These breaks can help prevent headaches from escalating and allow you to return to the social setting feeling more refreshed. Section 8. Recognizing when to seek medical advice. While occasional headaches and eye twitching may be managed with lifestyle adjustments and avoidance of triggers, persistent or worsening symptoms warrant medical attention. Seeking timely medical advice ensures that underlying health conditions are ruled out and appropriate treatment is provided. If you experience frequent or severe cluster headaches, consult a healthcare professional for a proper diagnosis and to discuss treatment options. Chronic or persistent eye twitching, especially when accompanied by other symptoms like redness, swelling or drooping of the eyelid, should also be evaluated by a doctor. It's important to remember that self-treating can be risky, and what may seem like a minor annoyance could be a sign of a more serious condition. Don't hesitate to reach out to a healthcare provider if you have any concerns about your health. They can assess your symptoms, provide personalized advice, and recommend appropriate treatment options if necessary. Section 9. Prioritizing your health and well-being. Navigating social situations as a former smoker requires a proactive approach to protect your health and well-being. By understanding your triggers, taking preventive measures, and prioritizing your health, you can enjoy social events while minimizing the risk of experiencing unpleasant symptoms. Remember that your health is paramount. Don't hesitate to excuse yourself from situations that compromise your well-being. Communicate your needs to friends and family, explaining your sensitivity to smoke and the importance of fresh air. Most people are understanding and will accommodate your needs. Living a smoke-free life is an ongoing journey that involves making conscious choices to protect your health. By staying informed, being prepared, and seeking support when needed, you can confidently navigate social settings and live a healthier, more enjoyable life.